Right, so this is chapter 3, stress and illness and disease. So far we've gone over the pioneers of stress, the fight or flight response, the stress model, the physiology of stress, and now we're going to go over the effects of chronic stress. Okay, so starting off with hot reactors. So hot reactors are individuals that react to stress with an all-out physiological reaction. I'm sure you might know a few people in your life that react to stress in a really dramatic way. And individuals that are hot reactors will suffer from chronic anger or chronic anxiety. And as a result of this all-out physiological reaction, they are more likely to have a high resting blood pressure, as well as be more susceptible to heart attacks throughout their life. And about 20% of the population are hot reactors. And this is really important because if somebody doesn't learn how to cope with their stress, it can definitely make them sick later on in life. And we're really worried about, things like heart disease, specifically heart attacks and strokes. Okay, moving on to psychosomatic disease. So just breaking up the word psychosomatic. So psycho, meaning from the mind, not necessarily crazy, but psychology coming from the mind. And then soma, meaning the body. So psychosomatic diseases are conditions that have both a mind and a body component. A lot of individuals say, when you tend to get sick from stress, they tell you that it's all in your head, but it's not. These diseases are very, very real, and they are not just all in your head. Moving on to psychosomatic disease types, we have two different types. We have psychogenic diseases and then somatogenic diseases. So psychogenic diseases, this is a physical disease caused by emotional stress, and there's no microorganism involved. So there's no irritant, there's no allergen, there's no virus, there's no bacteria. A really good example of a psychogenic disease would be something like asthma. So asthma is a psychogenic psychosomatic disease because there's no invasion of allergens or these disease-causing organisms, and the mind changes the physiology and parts of the body start to break down. So individuals are more likely to suffer from more asthma attacks when they're stressed out. Another really good example of a psychogenic psychosomatic disease can include something like you experience a stomach ache or you experience vomiting because you are so worried and so stressed out by a specific event that is coming up in your life. So there's no bacteria, there's no virus that's causing that stomach ache or illness. That is coming directly from that emotional stress. Moving on to somatogenic. So somatogenic, your mind increases the body's susceptibility to disease. So your immune system becomes weak as a result of being so stressed out. And then due to that weakened immune system, you become more susceptible to bacteria or viruses. So cancer and rheumatoid arthritis are suspected to be somatogenic, although there are definitely other real causes of these conditions, but they can definitely have an effect. Stress can have an effect on our immune system, therefore making us more susceptible to different types of cancers. For those of us that have rheumatoid arthritis, it could cause these rheumatoid arthritis attacks. Okay, let's talk about white blood cells, and because we're going to start talking about the immune system, and this is really, really important. So white blood cells, they are, part of the backbone of our immune system, and stress can actually decrease your white blood cell count. So in a healthy human adult, we have about 1 trillion white blood cells that are ready to take on any bacteria, virus, any pathogen that comes into your body, getting ready to attack it and to keep you safe and healthy. So we're going to talk about a few different types of white blood cells. We're going to talk about phagocytes, T cells, and B cells. And all of these cells, phagocytes, T cells, and B cells, are different types of white blood cells, and they all have a different function. All right, so just a little bit about how your immune system works. So a pathogen enters your body, maybe it's, well, hopefully it's not COVID-19, maybe, it's a different virus particle, or it's, bacteria that comes into your system. And our phagocytes, the purpose of our phagocytes is to destroy substances that are foreign to the body. So it's going to engulf the pathogen. And then helper T cells are summoned to that spot, and they identify that, okay, this is a pathogen, this is something that shouldn't be in our body. And then helper T cells also stimulate the multiplication of killer T cells and killer B cells. And then these killer T's and killer B's start to multiply. And then these killer T cells, they do exactly, as their title says, they're going to destroy those pathogens by puncturing the membrane of the attacker. And sometimes these attackers actually enter in our own cells. So they might even puncture our own invaded body cells. And they're going to kill our cells. They're going to kill the pathogen. That's the really big thing that they're after here. They're trying to kill and get rid of that pathogen. And then B cells will produce something called antibodies, and antibodies are proteins that will identify and kill the pathogen. And then eventually, once the invasion is under control, we have suppressor T cells that will stop the immune response, and they'll tell all of the other white blood cells, like, hey, it's okay, we're not under attack anymore, so we can pull it back a notch now. And then, so after the suppressor Ts have, let everybody know that it's okay, we're going to have memory T cells and memory B cells left behind in order to organize for a future attack. So these cells are left in the bloodstream and in the lymphatic system in order to recognize and respond to any future attacks by the same pathogen. So how does stress affect your immune system? So research has shown that stress decreases your white blood cell count, and it can make an individual prone to disease. And actually, your personality also has a little bit to do with being prone to disease as well, which is kind of interesting. We're actually going to talk about personality in more detail when we get to chapter 8. But in combination with the stress and your personality, it can actually make you prone for specific diseases. So there is plenty of evidence that's shown for just an overall disease-prone personality, individuals that are constantly depressed, angry, hostile, or anxious. And there's a cancer-prone personality. These individuals usually tend to be unassertive. They're over patient. They're way too patient. They have problems asserting boundaries. They purposefully avoid conflicts. And then we have our coronary heart disease prone personality. These individuals, they're angry, they're hostile, they're aggressive, and this specific personality type, if you know a little bit about personality types already, this is a type A personality, but again, we'll talk about personality types in more detail in chapter 8. But regardless, the decrease in the white blood cell count and then your personality, it can have a detrimental effect on your immune system, therefore putting you at risk for disease. We really don't want that. So what's something that we can do about it? Really interesting, your mood actually has a tremendous effect on your level of health and your immune system. So there's a study, I'm actually taking the study directly from your textbook. So researchers conducted a study on the effects of stress and immunity. So there's this salivary IgA. This is an antibody that fights infections. And again, research has found that negative moods will decrease this antibody, but it will increase with a positive mood. Anyways, so these researchers were conducting a study on the effects of stress and immunity. And so they took college students and they took a swab of their mouth. They were tested 5 days before an exam, on the day of the exam, and then 2 weeks after the exam. And they saw that the salivary IgA was the lowest, 2 weeks after their exam, as well as the day after their exam. So we can see that, having a decreased mood, being stressed out, it actually makes people more susceptible to disease, and it will suppress your immune system. And these positive moods, they increase this salivary IgA antibody level and enhance those immunosuppressive effects. So your mood and your attitude, it does make a difference. I know it might seem cheesy a little bit, some of the time, but it really does make a difference. And experts suggest that no illness is completely free from the influence of stress. So whenever you get sick, there's always going to be some stress in your life, whether that stress is caused by something else. But, once you get sick, you're probably starting to feel some of the stress of like, oh my gosh, I'm sick right now. I really need to get better. I need to do this. But so again, no illness is completely free from the influence of stress. Moving on to stress and cholesterol. So let's talk about what cholesterol is. So cholesterol is a waxy, fatty-like substance that our body produces. And we also consume foods that contain cholesterol. And our body needs cholesterol. Cholesterol is found in the fluid that coats our lungs, the sheaths that cover our nerves. And, we need cholesterol in order to absorb specific micronutrients. So we need a certain amount of cholesterol in order for our bodies to function properly. But when we have too much, that's when we can start to experience negative effects. So when we have too much, this cholesterol can collect on the walls of our blood vessels and become plaques. And this can eventually lead to blockages. So this could potentially lead to a heart attack or a stroke. And having too much cholesterol in our body, that is something called hypercholesterolemia. So this is a condition caused by very high levels of cholesterol. And we have two different types of cholesterol. So we have HDL cholesterol, high density lipoprotein cholesterol. So this is actually the good cholesterol. You want to remember the H for healthy and the H for high. So this is actually one type of cholesterol that we want to be high, because remember, high and healthy. And then the LDL cholesterol, that's the low density lipoprotein cholesterol. This is the unhealthy cholesterol. We want to remember the L for low. We want this to be low because this is the bad cholesterol that is, responsible for this hypercholesterolemia. Where was I? Okay, let's go back to HDL cholesterol, I'm sorry. So again, we want to remember that H for high, that H for healthy. HDL cholesterol will actually carry this bad cholesterol from other parts of your body, and it will take it back to your liver to have it removed. And there's a lot of interesting research on stress and cholesterol. So one study in particular, they looked at medical students and military pilots, and they saw that their cholesterol levels were the highest right before an exam. And then for accountants, usually tax time, I know it was a little different this year, but tax time is usually, right, due date is April 15th, and cholesterol levels for accountants dramatically rise as April 15th grew closer. So there's a very big link between stress and cholesterol levels. Really quickly, just to break up some of the monotony of, recorded lecture. So let's do a mini review. Are you ready? Okay. All right, first question. What tissue releases the corticoids, cortisol and aldosterone? So you can stop the video or I'll give you a second because I am going to give you the right answer. So it comes from the adrenal gland, specifically from the adrenal cortex. Next question. What is bracing? So bracing is that unnecessary muscular contraction, that unnecessary muscular tension. Next question. Which stress theory is associated with the perception of stressors? And it is the hardiness theory. I like to throw these little mini reviews, every once in a while within a lecture, so stay tuned for those in the future. Okay, back to lecture, moving on. Okay, let's talk about some specific illnesses and diseases that we know are caused by stress. Okay, the first is hypertension. Hypertension is also known as high blood pressure. And when you get your blood pressure taken at the doctor's office, they'll give you two numbers. They'll usually, tell you it was 120/78. So the first number is systolic, and then the second number is the diastolic. And that is the force. The systolic number is the force that is being exerted on artery walls, so when the heart is pumping. And then the diastolic refers to that period of relaxation. So we have always two numbers, our systolic and our diastolic blood pressure. And I guess actually I didn't even mention it here, but the definition of hypertension is excessive pressure on artery walls. And, if we experience this hypertension for an extended period of time, for years and years and years, it eventually can lead to something more serious. Does anybody know what the rupture of an artery in the heart is called? Anybody? It's called a myocardial infarction, also known as a heart attack. And then a rupture in the brain is known as cerebral hemorrhage. And the rupture can be caused by, a couple of different reasons, but usually, it stems from a stroke. So again, if we experience hypertension for months, for years on end, these are the big two things that we're really concerned about. We're concerned about heart attacks, and then we're worried about stroke. Let's talk a little bit more about hypertension, shall we? So normal, resting, healthy blood pressure is less than 120 systolic and less than 80 diastolic. Actually, the guidelines have recently changed just within the last few years. And so now, if somebody has a blood pressure of 140/90, this blood pressure is considered to be very high. And this information is astounding. Now 41% of individuals from ages 20 to 74 are hypertensive. So they have, some sort, they're, I don't know if they're very hypertensive, but they're right in between, after this cutoff. And it's scary. It's really, really scary that that many individuals have high blood pressure. And then even worse, 16% of 20 to 24-year-olds are hypertensive. And a lot of them probably have no idea that they have high blood pressure, because high blood pressure isn't something that you feel. I know that you might watch and you might see in the movies, someone comes stumbling into the emergency room and they're dizzy and they have blurred vision, and then they collapse on the floor and the doctor's like, oh my gosh, you have high blood pressure. But that's absolutely not the case for everybody. A lot of people are walking around with high blood pressure and they don't even know it. This is known as a silent killer because you don't feel it. Also, more men are more likely to have high blood pressure than women. And that's usually because, if you remember back in our first lecture, men have more of that fight or flight response. They are less of tend and befriend. They're less likely to reach out for social support to kind of alleviate their stress. So they hold on to that physiological response a little bit longer. I want to talk about some contributing factors of hypertension because it's not just stress that can cause high blood pressure. There are a slew of factors. The first is being genetic. So yes, high blood pressure does run in the family, or it can run in your family. Poor diet, which ultimately leads to obesity, kidney disease, smoking cigarettes, lack of activity, so lack of exercise, high sodium intake, oral contraceptives. So believe it or not, a lot of young women that are on birth control pills might have high blood pressure due to some of the hormones that are in these oral contraceptive pills. And then of course, stress. But if you have a combination of these contributing factors, that's pretty scary. So we need to make sure that we're getting our blood pressure tested at least once every 2 years, if not once a year, just to make sure that you are that you're in this normal, healthy zone, because again, it's the silent killer. Okay, moving on to stroke. Stroke is also called apoplexy. And a stroke is the lack of oxygen to the brain caused by a blockage or a rupture of a blood vessel. And a stroke that's caused by a blockage of a blood vessel is called an ischemic stroke. And a stroke caused by a ruptured blood vessel is a hemorrhagic stroke. And strokes can cause a variety of different my goodness, they can cause a variety of different, I don't want to say issues, but detrimental effects. It can, depending on what part of the brain that was affected by your stroke, it can cause paralysis, it can cause speech impairment, motor function impairment, and or, death might even occur. And stroke is related to these 3 big risk factors: having high blood pressure, poor diet, and stress. So this is something that's really important. I think this is something that everybody should know, because strokes, unfortunately, they're so common, and I want you all to know what to do in case, a friend or a family member, if you suspect that they're having a stroke, you want to make sure that you act fast. So FAST stands for face, arm, speech, and time. So you want to look at that person's face. You want to ask them to smile. It's half of their face drooping. Here we're looking for symmetry. If they can smile normally and we see both corners of their mouth nice and high on their cheeks, we don't have anything to worry about. But if we see that half of their face isn't responding and half of their face is drooping, that is worrisome. We're going to ask them to raise their arms just straight out in front of them. And if we see arm weakness, if we see one arm lower than the other, again, that is alarming. Have them talk to you, ask them questions. If their speech is slurred, again, very worrisome. They're most likely having a stroke with, these 3 things that I've just listed. And so if you notice these 3 things, you need to note the time from which the symptoms started, and then you also need to act quickly. So you need to act fast and call 911 right away and let the person on the line know that, your friend, family member, you suspect that they're having a stroke. Because the faster that we can get them to the hospital, the faster we can get, these specific drugs into them. And hopefully, if we get them there fast enough, they won't suffer, detrimental effects of their stroke. Moving on to coronary heart disease, or CHD. So heart attacks, these are the #1 killer of Americans. So heart attack, remember, also known as myocardial infarction. They may come without warning, and usually heart attacks are the end result of a long-term disease process. It's not like someone wakes up one day and they just have a heart attack for no reason. Usually there's a long list of, usually there's high blood pressure for an extended period of time. There's lack of physical activity. There's a poor diet. There's a lot of stress that's been going on for a number of years. And then this is the long-term end result of those things. So our heart requires a steady supply of oxygen in order to function properly. And if one of our coronary arteries becomes blocked, a heart attack results. And a heart attack that is caused by a blood clot is called a coronary thrombosis. And during a heart attack, part of the heart muscle, also known as myocardium, might die from lack of blood flow. And then risk factors for heart attack, and then also something called angina pectoris, which I'll get to in a moment, are high cholesterol, hypertension, and smoking cigarettes. So let me get back to this angina. You can say angina or angina, angina pectoris. This is a signal that the heart isn't getting enough oxygen to supply its needs. And angina is not a heart attack, but it's a warning sign. And angina is usually felt as, extreme chest tightness, or heavy pressure behind the breastbone, or even pain in the neck, the shoulders, the left arm. So this is something, if you or a family member later on in life is experiencing angina pectoris, this is something that's serious. So it's not a heart attack, but it's a warning sign. And this is something that you definitely should see a doctor about, just to let them know, I've been having some chest pain, and then there's an evaluation that needs to come after that to determine your risk of coronary heart disease. And hopefully it won't be from stress. Hopefully that won't be the case at all, but this class, we want to make sure that you're managing your stress so you don't ever get to this point and you don't ever become ill from stress. Okay. All right, coming back to these risk factors really, really quickly. So things like high cholesterol, hypertension, cigarette smoking, these major risk factors are modifiable. So these things are controllable. So we can control our diet and we can decide how much cholesterol we want to consume. We can decide whether or not we want to participate in physical activity in order to help control our hypertension. And then cigarette smoking, we get to decide whether or not we want to smoke cigarettes. So there's a lot that we can do in order to prevent cardiovascular disease, but we need to make sure that we're actually doing it. Another thing that's linked to coronary heart disease is having that type A personality, like I mentioned earlier. So individuals that have a type A personality tend to be really angry and pretty hostile all the time, usually for no reason. But again, we'll talk about personality types more in chapter 8, but this is definitely linked to coronary heart disease. All right, still talking about coronary heart disease. So a couple of things that I would like you to know is the difference between atherosclerosis and arteriosclerosis. So atherosclerosis, this is arterial clogging. So this is when we have, buildups of those plaques that occur in our arteries. And this process usually begins when our endothelial cells, and our endothelial cells are the cells that line our arteries, become damaged. And it's usually through a combination of factors like smoking, high LDL cholesterol, high blood pressure, or high glucose levels. And our body's response to the damage results in inflammation, and it changes the lining of our artery. And then we get these little plaques, well, not, some of them aren't little, but we get these plaques, these deposits that accumulate on our artery walls, and eventually, our arteries are going to become clogged. And then we have arteriosclerosis. Arteriosclerosis is the lack of arterial elasticity. So our arteries are eventually going to become hardened. They're going to lose their elasticity and their ability to expand and contract, therefore restricting blood flow. And then both atherosclerosis and arteriosclerosis puts you at an increased risk for blockage by blood clots. So again, looking at increased risk of heart attack and stroke here. All right, moving on, let's talk about our gastrointestinal system. Let's talk about ulcers. So we have 15 million Americans that suffer with ulcers. And these ulcers, they start with this fissure, or, this, we have fissures in our stomach, in our duodenum, or in our intestinal wall. And, we end up as a result, from experiencing stress on a regular basis, norepinephrine causes our stomach capillaries to constrict. Therefore, they secrete less mucus. So we have less protection, protecting us from that hydrochloric acid in our stomach. And our hydrochloric acid will eat away at our stomach wall, and it causes these ulcers, and it can cause a lot of pain and a lot of discomfort. And if you remember back to our physiology lecture, that example of bracing and taking excessive pain medication, specifically NSAIDs, can also cause ulcers. So we want to make sure that if we do develop an ulcer, we need to determine if our ulcer is due to stress or if it's due to some other cause, because actually another really big cause of ulcers, actually you'll learn more about it in the video I'm going to have you watch in a couple of weeks, but there's actually this bacteria that can also cause ulcers. So we need to make sure, is it coming from stress or is it coming from something else? Because if it's coming from stress, there are a whole slew of stress management techniques and things that we can use in order to decrease our stress. So, we don't have that effect of, the secreted mucus, the decrease in the secreted mucus for our stomach. Moving on to migraines. So migraines are awful. If you've ever experienced a migraine, you'll know exactly what I'm talking about. Migraines, you feel, they're severe headaches. You might feel, pulsating. You might have, experience nausea or hypersensitivity to light and sound with a migraine, and you just, it might be difficult to participate in regular activities of daily living. If you're trying to do homework or if you're trying to run around and do errands, it's almost impossible. This is something where you kind of need to, sit in a nice dark room and just kind of wait it out until the pain goes away. So the major problem with a migraine is with the dilation of blood vessels in the head. And any method of preventing increased blood flow, excuse me, let me go back here. So migraines are caused by the constriction and dilation of the carotid arteries on one side of the head. And then we have the constriction phase, also known as the pre-attack phase, and it occurs about, and this happens about 1 to 2 hours before the migraine. And this can cause light sensitivity and irritability that can last well within the migraine. And then when the dilation phase occurs, this is known as the attack phase. And this is when that pain starts. And that pain, it almost feels like it never goes away, and it just lasts for hours and hours. But okay. And usually migraines are a sign and symptom of a lifestyle gone wrong. So treating the signs and symptoms either with medication or meditation without eliminating the underlying cause, usually there's a part of someone's lifestyle, something that's going on. This isn't the best strategy. Rather than caring for the migraine, we need to make sure that we try to prevent it in the first place. So let's try to prevent it, whether we're using time management skills, we're getting rid of the thing completely, so it doesn't cause us stress. And there are some things in life that we can't completely get rid of. So in that case, we're going to employ a relaxation technique, whether we're using something like biofeedback, which we'll talk about later, meditation, or something called autogenic training. We can use this to kind of increase the blood flow in other areas, such as our arms and our limbs, kind of taking away from our head. And I know I was kind of all over the place with describing migraine headaches. So if you want, send me an email. We can set up a time over office hours and we can talk about migraines in more detail. Okay, tension headaches. So tension headaches, this is caused by bracing. So that's that unnecessary muscular tension. And for tension headaches, we're It's usually a lot of grinding of our teeth. So we're clenching our jaw, the muscles in our neck and our forehead are pretty tight. And these tension headaches usually can be alleviated through some sort of painkiller like aspirin, applying some heat on those tense muscles, or massage. But I actually highly recommend using something called progressive muscle relaxation. And that's something that we're actually going to be doing this week. And progressive muscle relaxation is, we're looking for different areas of our body that are tensed, and then trying to actively relax them. So you're going to be doing that this week, and I hope some of you enjoy it. Okay, moving on to cancer. So cancer, this is the unbridled multiplication of cells, and it can lead to tumors and organ damage. Cancer is caused by carcinogens, and carcinogens are cancer-causing agents. So carcinogens can vary from, it can be a chemical, it can be a virus. So something like human papillomavirus that causes cervical cancer, and other types of cancers, that is definitely a carcinogen. And then remember, our immune system is affected by stress. So our T lymphocytes will decrease during times of stress. And remember, our T lymphocytes, these are part of our immune system that destroy those mutant cells. So if we're stressed out and we're unfortunately diagnosed with cancer, our immune system isn't going to be able to, to continue to fend off those cancer cells that are multiplying. And chronic stress results in a chronic inability of the immune system to prevent the multiplication of mutant cells. So that's really scary. So we want to make sure that, I know this is really hard, especially, for anybody that knows somebody, or if you've even had cancer yourself, it's really, really difficult to maintain a positive attitude. But now treatment for cancer is, of course, including the traditional therapy, things like surgery to remove the tumors, radiation and chemotherapy, but now it's also including things like visualization therapy and maintaining a positive attitude, because researchers, again, we've identified that having a positive attitude affects your immune system. We want our immune system to be as strong as it possibly can be when we're going through something like cancer. So maintaining a positive attitude and then practicing visualization. So visualizing that your cancer is, those cells are dying off, they're not multiplying, imagining that your tumors are getting smaller and smaller and smaller. And research has shown that cancer patients that practice, maintaining a positive attitude and, the addition of that visualization therapy has had a much better outcome for a lot of cancer patients compared to those that are just doing the traditional therapy. So I think this is fantastic. Okay, and like we saw earlier, we know that there are individuals that are more prone to specific diseases, and cancer is one of them. So individuals that are more cancer prone, they're more likely to be unforgiving, they're holding on to resentment, they use self-pity, they lack the ability to develop and maintain meaningful interpersonal relationships. And again, social support, I'm going to sound like a broken record, is so, so important when it comes to stress management. Because humans, we're social creatures. We need to be able to connect with others. And then this individual, this cancer-prone person, also has a very poor self-image of themselves. Okay, moving on to allergies, asthma, and hay fever. So traditionally, when we experience allergies, the antigen gets into our system. So that antigen, that allergen gets into our system, and the antibodies recognize it and they attack it. And when the antibodies attack it, they release these chemicals, specifically something called histamine. And if there's too much histamine released into our system, our tissues start to swell and we start to create mucus. And this will cause our air passages to constrict. We'll have, stuffy noses. It'll be hard to breathe. And actually, stress has been shown to elicit, this asthma, allergy, hay fever response. So really, really interesting. There's a woman, she's shown a picture of one of her allergens. So she's shown a picture of like horses and hay because she's allergic to both. Just looking at that photo elicits an emotional response. And because, she gets worried and she knows that she's allergic to these things, it's actually going to stimulate a physiological response, even though the physical allergen is not present. Crazy, right? So stress actually makes our allergies worse. And again, no illness is completely free from the influence of stress. All right, moving on to rheumatoid arthritis. So rheumatoid arthritis, this involves an autoimmune response that causes joint inflammation. So our body is basically attacking itself when somebody has rheumatoid arthritis. And I'll show you a couple of photos on the next slides, what rheumatoid arthritis looks like. But we see inflammation and swelling in various body joints. Particularly we see it a lot in the hands, and the hands can become deformed. And so stress can actually cause these rheumatoid arthritis attacks. And then women are actually 3 times more likely than men to suffer from rheumatoid arthritis. So let me just show you what it looks like. So this is what a normal joint looks like. We have our cartilage, we have nice synovial membrane, there's lots of fluid. Our joints can move with, very little ease. It's not uncomfortable. And then we have osteoarthritis. So this is something that naturally happens to everybody as we age. So when we get into our 80s, hopefully our 90s, we're gonna have a little bit of osteoarthritis just because our cartilage starts to wear down from normal wear and tear over years of our life. And eventually we have bone rubbing on bone, and that becomes very uncomfortable. But for rheumatoid arthritis, our synovial membrane, so this nice big red piece in here becomes really, really inflamed, and our body starts to attack the cells that are in our synovial membrane, and it starts to deform our joints, and then eventually we have that being worn down, worn away, and our bones, kind of like osteoarthritis, they start to erode and go away, and this is incredibly, incredibly painful, and I'm going to show you what that looks like on a human. So this is an x-ray of a normal healthy hand without rheumatoid arthritis. And this is somebody that has rheumatoid arthritis, and we can see, that their joints are starting to kind of point in different directions. And then here's an example of a really severe case of rheumatoid arthritis. And this is something that can get progressively worse. And research has shown that rheumatoid arthritis definitely is affected by stress. Okay, moving on to backaches. So backaches, usually one of the most common causes of backache, specifically low back pain, is muscle weakness. So weak and inflexible muscles, but it can also be caused by bracing or a combination of the two. And having this constant, back pain, it can lead to spasms, and spasms can be really, really painful. Backaches impairs, individuals' abilities to do physical and cognitive work. And there are risk factors for backaches, back pain. So individuals that have a high perceived level of work stress, if they're experiencing a lot of mental distress and or depression, these individuals are more likely to engage in that unnecessary muscular tension and that bracing, and it's more likely to lead to backaches and back pains. Moving on to TMJ syndrome. So this is temporomandibular joint syndrome, and this is brought on by bruxism, and bruxism is that grinding of the teeth. Usually a lot of individuals tend to grind their teeth without knowing it, and it commonly happens at nighttime. And usually this gets diagnosed, you go to your dentist, they look into your mouth and they're like, huh, I see a little bit of erosion, going on in those back teeth there. And you're actually physically grinding those down by clenching down and grinding your teeth at night. So if you have been diagnosed with bruxism, I highly recommend that you get one of those protective mouthpieces. You can ask your dentist about it. You can even buy a cheap one at like Target or Walmart. Just because, you only have one set of teeth for your entire life, let's make sure that you take good care of them. But individuals with bruxism may experience facial pain, usually in this area, because this is where your TMJ, your temporomandibular joint, is located. So you have facial pain here, you might have some ear pain, you might hear a clicking sound when you move around your jaw, or you might even hear a clicking sound when you eat. This pain can also extend up into this temporal area. You could have a migraine, you can experience dizziness, and then even sensitive teeth, specifically the teeth that are located in the back of your mouth. Okay, moving on to obesity. So obesity is defined as a body mass index of 30 or higher. And so obesity from stress, it can come from a variety of different reasons. So some individuals, one of their coping mechanisms is stress eating. And usually when we stress eat, we're not reaching for the healthy foods, we're not reaching for the, the baby carrots and the apple slices. Usually we're reaching for comfort foods, and these comfort foods tend to be higher in fat and higher in sugar. And so when we're eating more of these comfort foods on a regular basis, this can lead to abdominal obesity. So, we end up carrying more body fat around our middle. And then eventually, again, if it goes on for an extended period of time, it could lead to diabetes. And actually, when we get stressed out, there is something called neuropeptide Y, and it is actually released released from certain nerve cells during stress. And research has also shown that, these neuropeptide Y and its receptors play a growth of human fat cells because they seem to play a role in our appetite. So increased appetite will also lead to potentially, becoming obese. And then I mentioned cortisol in the previous lecture. So we have to be really careful with the way that we cope with our stress, because yes, if it goes on for an extended period of time, it can definitely lead to obesity. Really quickly, I do want to talk about body mass index. I'll bring this up later on in the semester. So body mass index is based on the concept that your weight should be proportionate to your height. But for my people that are athletes out there, it's not reliable for your population because it doesn't differentiate between muscle weight and fat weight. And just looking at my example here, I have a man, well, two men. They're both 6 feet tall. They both weigh 250 pounds. And according to BMI, they're both obese. But obviously, this guy on the left here, he's very fit. There's no way that he could be obese. But, on paper, just because they're the same height and the same weight, they're both labeled as obese. So again, it's not going to tell you anything about how much muscle mass you have, how much fat mass you have. So for my folks that are athletes, if you, bring up a BMI calculator just because you're curious and you see that you're overweight or it shows that you're obese, but you carry a lot of muscle mass, don't worry about it. That's completely normal. So body mass index is really good just looking at the general population, but for athletes, we need to remember that, if we're carrying muscle mass, BMI isn't going to be the most reliable test for obesity. And in that regard, we really need to look at body fat percentage, and I'll actually bring up body fat percentage later on in the semester, but I just wanted to give you this little tidbit on body mass index. Okay, so talking about stress and other conditions. So stress affects pregnancy. Females that are exceptionally stressed out have an increased risk of miscarriage. And actually, stress while you're pregnant, that stress has an effect on the fetus. So all of the hormones that the mother is secreting, since mom and baby are connected, baby is also feeling the effects of all of those hormones as well. So moms that experience a lot of stress during their pregnancy, their children also tend to have, similar methods or similar ways of, physiologically responding to their stress once they are, born, once they're small children, growing up, getting into the world, they start to have that same, stress response. They are more likely to experience that physiological effect of stress, and it can have effects that carry on all the way until their adult life. Okay, moving on to sports injuries. So for my athletes out there, can cause more sports injury. So there's a stress injury model. So during sports events that are inherently stressful, there are some things that we need to look at to determine, what the, how likely is it that an athlete is going to become injured. So we need to look at the history of their stressors, their personality characteristics, how they cope with that stress, and how they, how those coping resources interactively, how the coping resources contribute interactively to the stress response. And usually we see more injuries in individuals that didn't have social support. So individuals, athletes that didn't have social support, they were more likely to experience more anxiety, more muscle tension, and they were more likely to get injured. So again, another reason why social support is so important. Another reason why looking at your personality is important, while looking at, what stressors have I experienced, and then overall, what's the likelihood that I'm going to get injured? So another great reason to manage your stress and to reach out for support when you are experiencing stress. Okay, so I want to talk about something really serious. I mean, everything that I've been talking about is super serious, but this lecture is, it's kind of a downer. We're talking about lots of negative things, lots of illness and disease and negative things that can occur. So I want to finish it off talking about post-traumatic stress disorder, also known as PTSD. So PTSD results from an extreme psychological and or physical event, and the individual must perceive this event to be extremely distressing. So this is something like a threat to one's life. And some examples of individuals that are at risk of PTSD are individuals that are, hurricane survivors, 9/11 survivors and responders, war veterans, car accident victims, rape victims, assault victims. So all of these, huge threat to one's life. All right, symptoms of PTSD. Individuals that have PTSD will commonly relive their traumatic event. So they will experience, consistent repetitive flashbacks. They might have dreams about that event. They will have a very uncomfortable reaction to a situation that is very similar to that event. So for example, a lot of, war veterans, they might be out in public and they hear a loud pop, and they have a very uncomfortable reaction due to the PTSD, from their wartime experience. A lot of individuals will tend to avoid, so that usually looks like emotional numbing or detachment, lack of interest in pretty much anything. They will avoid people and or places. They'll stay home. They'll avoid social support. They'll avoid almost anything. And avoidance can come in many different levels. So maybe we're showing lack of interest in some of our favorite things, or maybe we've completely started avoiding people, we've started avoiding family, we stopped going to work. And then moving on to arousal. So arousal can come, again, a variety of different levels. So some individuals, startle really, really easily. Other individuals are having a really hard time concentrating. They're hypervigilant. They're irritable. They're having trouble sleeping. So, some individuals, the stimulus for arousal there can either be very little, or they need a lot of arousal in order to function on a daily basis. So common treatments for PTSD are talk therapy. So going to a therapist, psychologist, and this is aimed for the patient to perceive the fear more realistically and less as a threat. Medications will be prescribed, usually things like antidepressants, anti-anxiety medications, and sometimes sleep medications. Exposure therapy, so we're exposing the patient to the event that precipitated PTSD. Exposure therapy happens in stages by trained professionals. We're not throwing them back out there into war, for example, but it can start by talking about the event and looking at maybe pieces of clothing or material or things that exposes them to that specific event. And then the last really cool PTSD treatment is virtual reality. And I ask that you watch both of these videos. They're both pretty short, but just showing you two different PTSD virtual reality sessions with war veterans. So when you have a moment, yeah, go ahead and watch these because this is super, super interesting. Oh. Back to review. Okay, so which of the following describes eustress? So is it A, stress, which is associated with negative life events, B, stress that leads directly to illness, C, stress associated with more positive events, or D, none of these? And the correct answer is C. So eustress is stress associated with more positive events. So something like, planning a vacation, getting married, a promotion at work. So anything that is associated with a positive event. Okay, which part of the autonomic nervous system is responsible for conserving energy? I went a little too fast with that one, but the correct answer is the parasympathetic nervous system. The last question. Positive events that make us feel good and can offset the effects of hassles are called daily uplifts. Daily uplifts. Oh, I'm not going to ask you this question, so ignore this. We're not talking about this yet. We're going to talk about this in chapter 4, so I'm going to swing by here. So before I finish this lecture, I just want to make sure that we understand the stress model. It's life situation, perception, cognitive appraisal, emotional arousal, mind-body link, physiological arousal, physical effects, and then illness and disease. Again, I want to make sure that we're doing everything that we can to understand the stress model in order to avoid becoming sick due to stress. We need to make sure that we're identifying, what is stressing us out. We need to identify how we react to stress. And then we need to figure out ways of how to intervene at different points of the stress model. And we'll talk about specific interventions in a few weeks. But before then, we're going to actually talk about specific stressors that college students experience. And then we're also going to talk about how personality can affect our stress response. So again, make sure that this is a stress model that you remember, The stress model will come up again officially in chapter 5, but when it does, I want you to remember this one. Okay, and that's it for chapter 3. So if you have any questions, feel free to reach out, email me, make an appointment during office hours, and we can chat.